Top 10 states with coronavirus. Just as much of the United States was recovering, 10 states have the highest 7-day average number of new cases of coronavirus per day when the pandemic began months ago, according to a CNN analysis by Johns Hopkins University. The data includes new cases reported by Johns Hopkins on Tuesday. Record high averages include Alabama, Arizona, California, Florida, Nevada, North Carolina, Oklahoma, Oregon, South Carolina, and Texas. Monitor the virus in your state and throughout the United States. Texas also reported a record high number of daily COVID-19 hospitalizations, 2,326, on Monday. Los Angeles County, which is nearly half the number of California cases, again reported one-day highest new cases on Wednesday, although officials said the spike was due to delayed test reports. While some politicians have seen higher case numbers as better testing, recent gains are faster than test growth, said Dr. Ezekiel Emanuel, president of the Department of Medical Ethics and Health Policy at the University of Pennsylvania. You can get a small percentage increase due to testing in the number of cases, he said. But when you see a 50% or 150% increase in the number of cases, what we see in the South, it's not testing. It's new cases. It's a community spread. How states develop. According to Johns Hopkins University, 21 states see an upward trend in newly reported cases from week to week: Alabama, Alaska, Arizona, Arkansas, California, Delaware, Florida, Georgia, Hawaii, Kansas, Oregon, Louisiana, Montana, Nevada, North Carolina, Oklahoma, South Carolina, Tennessee, Texas, West Virginia, and Wyoming. There are a stable number of newly reported cases in 8 states: Connecticut, Indiana, Maine, Mississippi, Ohio, South Dakota, Utah, and Washington. 21 states are on a downward trend: Colorado, Idaho, Illinois, Iowa, Kentucky, Maryland, Massachusetts, Michigan, Minnesota, Missouri, Nebraska, New Hampshire, New Mexico, New Jersey, New York, North Dakota, Pennsylvania, Rhode Island, Vermont, Virginia, and Wisconsin. In one state, Vermont, the decline has been at least 50%. Nationwide, more than 2.1 million people have been infected with the coronavirus and more than 117,000 have died. What states must do if they do not want to close again? We see these flares, these hot spots are now emerging in many states, especially Texas, Florida, Arizona, said Aaron Bromage, an assistant professor of biology at the University of Massachusetts at Dartmouth. These cases are growing really fast. And most importantly, the number of hospitalizations in those states is increasing, which is usually a few weeks behind the number of new cases. Florida recorded nearly 2,800 new cases of coronavirus on Monday, the most new and confirmed cases in a single day, according to the Florida Department of Health. But Governor Ron DeSantis said the state will not close. We are moving forward. We will continue to protect the most vulnerable, DeSantis said. He also urged residents to maintain social distance and avoid crowds. States do not have to shut down again to control the virus, Bromage said. They just need clearer communication to guide their population to do what? Get masks for the population. We know it helps, he said. Strengthen the social distance between people. And slow this competition to reopen, completely. Because if you don't, then we know that these spikes in cases, if they keep growing, always precede really big cases in hospitals. West Virginia board member Jim Justice announced the 6th church-related outbreak. 3 are still active, he said. At least 32 cases have been identified in one church in County Greenbrier and 4 cases in a church in Ohio County. The court did not say how many parishioners had a positive result at Boone County Church, which was the 3rd active outbreak site. Texas mayors want to demand masks in nearby public spaces. 9 Texas mayors, including those in Houston, Dallas, Austin, and San Antonio, have urged Governor Greg Abbott to give them the authority to require masks be worn in public where physical distancing cannot be practiced. In a letter to Abbott, The mayors said many people in many of our cities are still refusing to wear these face coverings even though these coverings are scientifically proven to help prevent the disease from spreading. The governor agreed that wearing a mask is very important but expressed reservations about enforcement and potential punishment. All of us have a collective responsibility to educate the public that wearing a mask is the best thing to do. A growing number of studies show face masks reduce the spread of the coronavirus, especially because many people are contagious before they have symptoms and because this virus can spread by just talking or breathing. Arizona Governor Doug Ducey resisted calls from physicians across his state to mandate wearing masks in public places, saying he would leave that up to mayors to decide, because the level of transmission vary from region to region. Montgomery, Alabama, Mayor Stephen Reed issued an executive order requiring masks or face coverings to be worn in public places, a day after the city council failed to pass an ordinance with that requirement. An estimated 230,000 to 450,000 cases of the virus were prevented in the states that enacted requirements for mask use between April 8 and May 15, a study reported Tuesday found. The findings suggest that requiring face mask use in public might help in mitigating COVID-19 spread, wrote Wei Liu and George Webby, with the Department of Health Management and Policy at the University of Iowa's College of Public Health. Another study published in the Lancet Medical Journal also said wearing a face mask decreases the chances of spreading coronavirus. A second wave might come, but we're still in the first wave. A second wave of coronavirus could start in late August, with the U.S. reaching more than 201,000 COVID-19 deaths by October 1, according to the Institute of Health Metrics and Evaluation at the University of Washington. But analysts say the rates of coronavirus haven't even dropped to a level low enough to call the first wave over. As the virus spreads, it appears to be following highways as more people go out and more places reopen, researchers from Children's Hospital of Philadelphia and the University of Pennsylvania said Tuesday. They cited south to north spread along I-95 on the east coast, I-85 in the south, and I-5 and I-10 in the west, the team said. Meantime, New York and New Jersey no longer have the highest per capita infection rate. That would be the Navajo Nation, which spans parts of New Mexico, Utah, and Arizona and has a population of about 173,600 people. The Navajo Nation announced lockdowns over the next 2 weekends to try to help quash the outbreak. The first is expected Friday to Monday, and the next will take place the following weekend. Now is not the time to back down, Navajo Nation President Jonathan Nez said. Wear your masks, practice social distancing, and wash your hands. Some Americans are exhausted from the pandemic, acknowledged Dr. Ashish Jha, director of the Harvard Global Health Institute. But people can't let their guards down. We may be done with the pandemic, he said, but the pandemic is not done with us. CNN's Ethan Cohen, Liz Stark, Dave Alsop, Lindsay Benson, Jen Christensen, Shelby Lynn Erdman, Roger Razak, Ashley Kiloff, Amanda Watts, Teresa Waldrop, Pierre Mulhan, Rob Fress, and Dave Alsop contributed to this report. Thank you for watching. Please like, share and subscribe to our channel.